Have you ever contemplated how a tiny sandfly could cause a devastating disease like Leishmaniasis? It's a puzzling question, isn't it? A minuscule creature, barely visible to the naked eye, is responsible for a disease that has perplexed and troubled the medical community for ages. This microscopic menace, the sandfly, is the primary vector of Leishmaniasis. Intriguing, isn't it? The complexity behind such a simple creature's ability to cause such havoc. Stay tuned as we explore the history and evolution of this fascinating yet deadly disease. The history of Leishmaniasis is as intricate as the disease itself. Just like a detective novel, the story of Leishmaniasis is filled with twists and turns. This parasitic disease has been lurking in the shadows of human history for thousands of years, with the earliest recorded instances dating back to the time of the pharaohs in ancient Egypt. In fact, evidence of the disease was found in the remains of a 21-year-old man from the 21st dynasty of Egypt around 3,000 years ago. However, the journey of Leishmaniasis didn't stop in Egypt. It traveled across continents, making its way to regions of Asia, Africa, and the Americas. This silent traveler was often misidentified and misunderstood due to its diverse range of symptoms. From skin sores to organ damage, Leishmaniasis presented itself in many forms, confusing physicians and researchers for centuries. So how did we come to understand this elusive disease? Well, it was a long and winding road. In the 19th century, a British Army doctor named William Boog Leishman was posted in India. Intrigued by the mysterious disease affecting the soldiers, he began to study it and discovered the parasite responsible. Thus, Leishmaniasis was named in his honor. But understanding the disease was just the beginning. Over the next century, researchers delved deeper into the life cycle of the Leishmania parasite, its modes of transmission, and the various clinical manifestations of the disease. It was a painstaking process, but one that eventually led to a more nuanced understanding of Leishmaniasis. Despite the progress, Leishmaniasis remained a formidable foe. Even today, it continues to pose a significant health risk in over 90 countries worldwide. But with the collective efforts of scientists, medical professionals, and communities, we've made significant strides in combating this ancient adversary. From a mysterious ailment to a well-researched disease, Leishmaniasis has indeed come a long way. Yet the fight is far from over. As we continue to unravel the complexities of Leishmaniasis, we draw closer to the day when this ancient disease is finally relegated to the annals of history. The evolution of Leishmaniasis is a testament to the relentless efforts of scientists across the globe. For centuries, Leishmaniasis remained a mystery, an enigma wrapped within the folds of our limited understanding. But with the dawn of the 20th century, a new era of discovery began, marked by significant scientific breakthroughs that began to unravel this complex disease. As we moved into the early decades of the century, the identification of the Leishmania parasite, the discovery of its transmission through the bite of a sandfly, and the understanding of its life cycle, all represented significant milestones in our quest to understand and combat Leishmaniasis. Advancements in technology played a crucial role in these discoveries. The advent of microscopy, for instance, allowed scientists to view the microscopic world, revealing the parasite's intricate structure and its complex life cycle. More recently, the development of molecular biology techniques has enabled the identification of different Leishmania species, further enriching our understanding of the disease. As we charted the course of Leishmaniasis, we also began to develop effective diagnostic methods. From the early days of clinical observation to the use of serological tests and now molecular diagnostics, the strides we've made in diagnosing Leishmaniasis have been nothing short of remarkable. And what about treatment? Over the years, we've seen the evolution of treatment options, from the use of antimonial drugs in the early days to the more recent advent of liposomal amphotericin B and miltefosine. Each new discovery, each new advancement has brought us one step closer to effectively managing this disease. Yet the journey is far from over. As we continue to grapple with Leishmaniasis, we are constantly learning, constantly evolving, and constantly pushing the boundaries of our understanding. The fight against this disease is a testament to human resilience, to our capacity for innovation, and to our relentless pursuit of knowledge. The evolution of Leishmaniasis is a reminder that scientific progress can indeed turn the tide against even the deadliest of diseases. The Leishmaniasis we know today is far different from the one known centuries ago. Over time, our understanding of this disease has grown considerably, and so have our strategies to combat it. Today, Leishmaniasis is a global concern, with cases reported in nearly 100 countries. The regions most affected are parts of Africa, Asia, and South America. However, it's not just the tropical climates that host this disease. There have been cases reported in Southern Europe as well. Leishmaniasis is caused by a parasite which is transmitted via the bite of infected sandflies. There are various forms of the disease ranging from cutaneous leishmaniasis, which affects the skin, to visceral leishmaniasis, the most severe form, which affects vital organs. In terms of treatment, antimonial drugs have been the mainstay for many years. However, due to their toxicity and increasing resistance, alternative treatments are being sought. Some of these include liposomal amphotericin B, miltefosine, and paromomycin. While these treatments show promise, they also have their own side effects and limitations. The good news is that research into leishmaniasis is vibrant and ongoing. Scientists are exploring new avenues to tackle this disease. These include the development of potential vaccines, improved diagnostic methods, and more effective treatments with fewer side effects. Furthermore, there's a focus on understanding the ecology of sandflies to prevent the spread of the disease. Innovative approaches like genetically modifying these insects to reduce their ability to transmit the parasite are being studied. On a broader scale, efforts are also being made to improve public health infrastructure, particularly in regions where leishmaniasis is prevalent. This includes strengthening disease surveillance systems and enhancing access to medical care. While we have made significant progress in understanding and managing leishmaniasis, the journey is far from over. As we continue to evolve our knowledge and strategies, the hope is that one day, leishmaniasis will be a thing of the past, a footnote in the annals of medical history. So what have we learned about leishmaniasis? Well, we've certainly covered quite a bit of ground. We started by unraveling the puzzling question about this tropical disease, then journeyed back in time to explore its origins. We discovered that the history of leishmaniasis is as complex as the disease itself, stretching back centuries and crossing continents. We dived into the evolution of leishmaniasis, understanding how it has adapted and changed over time, and how our knowledge of it has grown. We've seen how this disease, once considered a malady of the past, is very much a concern in the present day. We've also explored the current scenario of leishmaniasis, highlighting the critical importance of research and awareness. We've learned that despite significant strides in our understanding and treatment of the disease, leishmaniasis continues to pose a significant health challenge in many parts of the world. This journey has underscored the critical importance of continued research into leishmaniasis. Only through a deep and nuanced understanding of this disease can we hope to develop effective prevention strategies and treatments. And let's not forget, awareness is key. The more we know about leishmaniasis, the better equipped we are to combat it. As we continue to unravel the mysteries of leishmaniasis, one thing is clear. Every bit of knowledge brings us one step closer to winning the battle against this disease.